Hello, everyone. Welcome to another Monday training. This is Rob Van Bergen from Pain Free for Life. Today, I want to talk to you about tongue stimulation and the many, many benefits that we see from performing this simple yet groundbreaking treatment. Now, for the last couple of years, tongue stimulation has been one of the primary methods for us to treat anyone with a traumatic brain injury. And this is based off of the work by Dr. Norman Doidge. Now, Doidge's work sort of involved the concept of treating the pons in the brain through the tongue, which is a very, very interesting method. Now, the pons, in case you're wondering what the pons is an essential part of the brain that's located above the medulla, and it falls kind of in the category of the hindbrain. Now, the pons' role, its function in your brain, is the regulation and control of a number of vital functions. Now, because it's contributing to the cranial nerves, right? Then you know that it's doing everything from smell to hearing to taste, even to movement. So it's a very crucial little piece of the body. Now, the concept shared by Doidge was one that if we were to access the nerves in the tongue, we should be able to access the pons, because the tongue's nerves actually go up into the brain and they sit there right in the pons. So then if you could use that as kind of like a superhighway to connect the tongue to the pons, you could send the frequencies up to the pons and disperse throughout all of the cranial nerves. So it's really quite a fascinating topic. Now, treatment was anticipated by Doidge to help, in particular, traumatic brain injury, Parkinson's, and MS. And that's really where they've kind of stuck in their kind of wheelhouse there. Now, this treatment was at the time just research. And our own Dr. Hache was the one that read the book and said, you know what, maybe we can do something about this. There was no device specifically designed to perform the protocol. Now, by chance, our microcurrent devices were already set up to perform this protocol. And in Dr. Doidge's book, he doesn't just allude to, he directly tells you the frequency and the modulation rate. So we knew we could do the treatment. But we were kind of looking and thinking, are we really going to shove a Y probe in someone's mouth? I mean, it could be impossible in some cases, right? And also uncomfortable. So we knew that we needed a kind of approach, a tool that would enable us to actually treat the tongue without sticking a big metal thing in your mouth. So this was the tongue stimulator. And you can see this right here, this little tiny guy that is thin enough to sit right there on your tongue, have you close your mouth. It even gets used to treat your gums and anywhere else in the mouth if anyone ever needs it. So it really has a lot of uses. So we got this attachment, we started to put it out there, and honestly, the results that we saw from people were beyond what we expected. We were really going along the same lines of Doidge, right? Like, let's treat people with TBIs. Let's treat people with Parkinson's and MS. And you know, those things, that was working too. But people were just like, well, could I use it for this? Or could I use it for that? And truth is, like, we were just saying, yeah, sure, give it a try and see what happens, because there's no real harm in doing it. And it was working. So things that we saw that we didn't think possible. Sense of smell returning in people that had lost their sense of smell. Loss of taste was reversed as well. And I believe the taste and smell things have also applied to people that have gotten COVID, that have had those issues. They've done tongue stimulation and the issue has been reversed. People with vertigo. Vertigo like just goes away when you do tongue stimulation. And I had one case with one lady who used it. She had chronic vertigo. She used it one time, and I was telling her to try and trigger the vertigo when she was doing it, which is what we like to try and do. Do the thing that triggers the vertigo. Unfortunately, she couldn't do it. She couldn't figure out how to trigger it. She had the tongue stimulator on her mouth. She was doing all the things she'd normally do, almost being a contortionist to try and trigger the vertigo, and it wouldn't come on. It was only then that we realized that, well, no, and it never came back. It didn't matter what she did. It didn't come back because she was doing the tongue stimulation when she was trying to trigger it. So all it took was that one brief moment to kind of take it away there. Tremors improving in people that have tremors, as well as gait. People that have a hard time, walking straight. People that had drop foot were also experiencing benefits from tongue stimulation. Nausea, especially that in medication withdrawal, would go away. Some hearing issues went away, and I have to say some because hearing and microcurrent seems to be kind of 50-50. I don't want to make any promises there. And then people that experience chronic migraines, their migraines could go away if nothing else was working. So, and as I say, this was on top of helping people with MS, Parkinson's, and TBIs kind of unwind the damage that's been done to their bodies. So a few months into doing this treatment, and surprisingly almost overnight, Health Canada approved this treatment for TBIs and Parkinson's. And a company cropped up in Canada. I won't mention the name of the company here. They started to sell a device designed specifically to treat the tongue with this single frequency. And the device costs $30,000. It's not covered by insurance, and it's not given to the patient. So treatments are done in clinic. I think it's 6 weeks of treatment for $30,000. And there may be follow-ups that are done after that as well. So in comparison to this, our Avasia Life Genesis and a tongue stimulator at about $675 started to look really good. Not to mention the fact that you can own it and you can do so many more treatments with it. I would hazard a guess that we get more business from their protocol with our devices than they do, because people are finding that this treatment works and they're finding that they can do it for pennies on the dollar, really. So today, tongue stimulation is still one of the most effective treatments for so many things. And recently we published an article based on our observations where we were seeing more and more people that experience chronic pain that were using the tongue stimulator to unwind the brain's obsession with pain. So their pain wasn't going away. It kept coming back. You know, they'd get some relief and then it would roll back in. And what they ended up doing is, by doing tongue stimulation before treatment, they were able to kind of shut the brain's obsession down, right? Maybe tell the brain, access the pons, access the cranial nerves, and get it to stop doing the silly things it's doing. And that's really, you know, when you break it down, what we're seeing this attachment doing. It is a way to rewire your brain out of bad habits, out of incorrect habits. And all of those things I mentioned earlier, right? The sense of smell, the sense of taste, these are all bad brain habits. So this is like a way of hacking the brain and getting it to do what you want it to do. So this is absolutely a great tool to have on hand if you have any issues at all that could connect to the cranial nerves. So that about wraps it up, guys. Thank you very much for joining me. If you have any questions about the protocol, the tongue stimulator, or anything else at all, drop them in the comments below. Otherwise, I hope you will join me next week for another Monday training. All right, everyone, have a phenomenal week. We're here if you need us.